Hi, I'm Dr. Robert Laprade from Twin Cities Orthopedics in Edina, Minnesota. Our paper in AJSM was entitled Comparative Outcomes Occur After Superficial Medial Collateral Ligament Augmented Repair versus Reconstruction, a prospective multi-center randomized controlled evidence trial. And it was a collaborative study between the universities of Oslo and Aarhus. The most important takeaway from the study is that we validated that an anatomic-based MCL reconstruction restores both stability subjectively and objectively to the knee with a grade 3 MCL tear. In effect, the study involved a collaboration among all three centers with a series of quantitative anatomy, biomechanical cutting studies, and robotic validation of an anatomic surgical technique, and ultimately it led to the current clinical study and one of the largest MCL reconstruction cohorts published in the literature. Overall, we validated that either a hamstring augmentation or a complete MCL reconstruction with a hamstring graft can equally restore valgus stability to a knee with a grade 3 MCL tear. A unique part of this study was a collaboration that both my center and our colleagues at the University of Aarhus participated in, and that we basically changed the way that we perform MCL reconstructions with autografts based upon the scientific information that we got from the study. Our group found that using anchors to hold the graft to the femur didn't work, and we ultimately went to using a tunnel, whereas the Aarhus group changed their surgical technique to have the anchors on the distal tibia attachment side of the MCL rather than letting them come directly from the pes tendons. And we found out that our outcomes were much better with these adaptations. This information will prove useful for those wishing to perform MCL reconstructions with either autografts or allografts in the future to restore stability to an MCL injured knee, and they can pair it with an early range of motion program to minimize the risk of postoperative arthrofibrosis. Thank you.